community recommend for patients with uncommon EGFR mutations, such as G719X? Seems like perhaps afatinib is the first line, maybe even debatable among specialists. And do these patients also have the same options to participate on clinical trials? So my typical, when approaching an uncommon EGFR mutation, I actually try to go directly to the source and looking for what may already been published about a certain mutation. Some are more common uncommon EGFR mutations, so we know a little bit more about the response rates with different drugs like afatinib. But some are truly kind of case reports. And I think we just kind of do the best that we can in terms of looking what's available. Afatinib for me has been kind of my go-to with some of the uncommon mutations, just because it does have the most data published. With clinical trials, so that's where the tricky part comes in. A lot of these clinical trials with EGFR mutations, because of how complicated things have gotten, the clinical trials can be very specific that the patient must only have had the common EGFR mutation. They're not necessarily taking any EGFR mutation. But I do think that this is an area too of active clinical interest. So it might just take a little bit more digging to find the correct clinical trial. The next question. Well, I think this is the $1 million question. So checking for mutations is a standard of care, but insurance companies are still refusing to cover. Any suggestions? This is a great question. Unfortunately, I still do encounter this. Not as frequently as earlier in the days, but it still happens. I would say we really just have to be persistent. And I have had to do peer-to-peers with multiple insurance companies explaining what we mean. We order the testing. I think sometimes there's a confusion on the billing code that it looks like we're trying to do genetic testing, which is a slightly different testing. This genetic testing, to the mind of insurance companies, is looking at, are there any cancers that are inheritable? But when we look at the mutations, for our purposes, we're really checking it in the cancer itself. And I've found that sometimes that is just a misunderstanding, but we just have to be persistent. I mean, it's in the national guidelines. We really publicize it quite a bit, I think, as an oncology community. But I don't really know that I have any great solutions to solve this problem.
Thankfully, I think it's happening a little bit less frequently than before, especially as we now are using more liquid biopsies and tissue biopsies at the time of resistance. And so I do think that it does still come up, but less frequently. And then we certainly, I know that all of our care teams are advocating for our patients and taking the extra steps to really talk to the insurance companies to make sure that they understand. And by far and large, it does end up getting approved, sometimes just through some extra steps, but most of the time it really does get approved.